Thank you, Mr. Speaker. You know, New Brunswickers without a doctor or nurse practitioner really are at the end of their rope. The stopgap measure, Mr. Speaker, that this government has put in place called NB HealthLink, they hired Medavie to provide, now has waiting lists to get on the waiting list to see a healthcare provider at one of their private clinics. It's not working. Replacing solo doctor practices with collaborative care teams has been trumpeted as a solution since Premier Bernard Lord was in this House. Yet, where's the big push, Mr. Speaker? It takes a budget big enough to pay the team members along with working with the physicians, whether they're part of a family practice or working in a community health centre. Can the Minister of Health tell this House how much was Horizon's budget request to establish collaborative care teams in family practices and at community health centres for the coming year?
Thank you very much, Mr. Speaker. And I am amazed that the member from the Green Party is dishing HealthLink, because, Mr. Speaker, this was a Made in New Brunswick success story that has actually reduced the waiting list of people waiting for doctors from a high of well, again, the numbers keep changing on a regular basis, but right now there are 54,000, just over 54,000 people that are registered with Access, another 30,000 that are registered and just waiting for the clinics to open up. We have a clinic on the north side that's just about ready to open up and expand, and we have a clinic on Mapleton Road in Moncton. Mr. Speaker, that is access. That's access to primary care to find a solution to the problems that other jurisdictions right across Canada are facing. And you don't have to look far, where our friends in Nova Scotia have a waiting list of over 200,000 without a family doctor, Mr. Speaker. There is a significant investment that's made in this budget. I'm anxious to get to the estimates.
Time, Minister. Member for Ferguson South and Leader of the Party.
Mr. Speaker, I invite the Minister of Health to join me in my constituency office to meet with constituents who are on the waiting list to see a primary health care provider through his NB HealthLink success. Mr. Speaker, when the Attorney General was the former Attorney General with Premier David Alward's, let me start over. When the Attorney General was former Premier David Alward's Minister of Health, he was a big supporter of collaborative care teams back then. No one has made an argument to the contrary. Yet New Brunswickers remain largely dependent on solo family practices if they're lucky enough to have a doctor or nurse practitioner. Vitalite has a plan to convert all the solo doctor family practices in their regions to collaborative family care teams. So can the Minister tell the House how much Vitalite requested in this budget to achieve this, and what actually is included to transition the Vitality regions to collaborative family?
Thank you, member. Minister of Health.
Well, thank you very much. And yes, Vitality is one of the partners that we have that are, again, moving a number of the doctors into collaborative practices. Excuse me. And we're committing $20 million right now in this budget to Vitality to expand those family practices, make them into collaborative practice. And Mr. Speaker, there was a number of suggestions with Vitality that savings would occur as these doctors took on a larger number of patients. So we want to see those results. We want to see how that rolls out, because, Mr. Speaker, we know that there's an aggressive plan by Horizon, by Vitality, by the New Brunswick Medical Society to move the existing doctors into those collaborative practices. And this government is behind that investment. This government is making significant investments in the medical field. And again, with HealthLink as a temporary measure, that is a way that allows people to get to primary care now as things.
Thank you, Minister. Member for Ferguson South and Leader of the Party.
Thank you, Mr. Speaker. Well, in a landmark report from a forum of medical associations and healthcare workers and health NGOs and unions, it was hosted by the New Brunswick Nurses Union and the New Brunswick Medical Society. In their report, in their recommendations, they said an investment of $70 million would be required from this budget to move away from solo family practices to collaborative care teams, whether they're in family practices settings or in community health centers. The Vitality Health Network has said it will take $56 million to transform the solo family practices in their regions to collaborative family care teams. Mr. Speaker, as the Minister pointed out, this budget only contains $20 million for this purpose across the entire province between Horizon and Vitalité. Mr. Speaker, I want the Minister of Health to explain to this House why he wasn't successful in making their case to the Premier.
Minister of Health.
Mr. Speaker, the logic of the Green Party is just flawed. Totally here today. Mr. Speaker, when they talk about only $20 million, $20 million is a significant investment to move physicians into a collaborative practice, Mr. Speaker, and we're anxious to see those results. I visited the clinic in Dieppe, which is an example of how these collaborative practices work, and with a number of RNs and a number of admin staff that are, again, covered by the RHAs. That allows the doctor to free up their time to check on the patients as the RNs are working to their full scope of practice, or the NPs. And that clinic is going to expand, and they expect that they'll be able to take on 15,000 patients in the not-too-distant future, Mr. Speaker. That's the model that's going to roll out. And though the members opposite minimize the investment made in healthcare.
Thank you. Leader of the Official Opposition.